The Ministry of Health has requested that any influenza vaccines and dTap vaccines given to pregnant women during the 28 to 38 week period are now sent to the NIR. To record a vaccine, I'll firstly bring up a patient. Okay, and I can select F4 or this icon on the toolbar. Firstly, I need to gain consent from the patient and either opt on or off for NIR. Here I can see the list of schedules. Check to see if the flu schedules are applicable to the patient, and if they are, tick the relevant schedule. So, seasonal flu vac no claim schedule or flu 65+. These vaccines will be recorded under Immunization Schedule 1. If the patient does not fit the schedule criteria, we'll then go to the All Immunizations tab 2, and we'll need to select the single vaccine icon to give the immunization. Coming to the vaccine drop-down, I can then select the relevant vaccine and fill out all the necessary information for this. This message has occurred because the patient has opted on for NIR, but some mandatory fields have not been filled in. So I can correct this now and pop in the batch number and expiry. So the mandatory fields for the vaccines are the outcome, route, site, batch number, expiry, recall reason, and you also need to make sure that you have the provider set to the doctor, and then the vaccinator can be who gave the vaccine, so the nurse or the doctor. There's also mandatory fields from the patient register that needs to be entered, so that would be given name, date of birth, NHI, ethnicity, postal and street address, and then also the next of kin. So that would need to be entered into the F3 patient register screen of MedTech. If this patient was pregnant, to record the pregnancy dTap 28 to 38 week immunization, I'd come to Schedule Selection 3 and scroll down and select the schedule here. So we can put the patient onto the schedule, and then if I come to Immunization Schedule 1, it's showing here in this tab. Now I can click on the group immunization to give the vaccine, and again I need to enter the relevant information, and OK, and so I need to correct this missing patient register information for it to be sent to the NIR.